Hypertension, a PowerPoint presentation by Miranda Jones. What is blood pressure? Blood pressure is the pressure of blood within your blood vessels. The pressure is created by the heart contracting and stabilized by using the resistance of the small arteries. Blood pressure keeps blood flowing throughout your entire body and it supplies your organs with oxygen and energy. Systolic pressure is the first number in a blood pressure reading, and diastolic pressure is the second number in a blood pressure reading. Here we have a chart describing the stages of blood pressure. Normal blood pressure is systolic, measuring 120 or less, over diastolic, measuring 80 or less. Elevated pressure is systolic, measuring 120 to 129, over diastolic, 80 or less. High blood pressure stage 1 is systolic pressure measuring 130 to 139, or if diastolic pressure measures 80 to 89. High blood pressure stage 2 is when systolic pressure measures 140 or higher, or if diastolic pressure measures 90 or higher. Hypertensive crisis, when systolic pressure measures higher than 180 and or if diastolic pressure measures higher than 120. What is hypertension? Hypertension occurs when blood pressure is high enough for long enough that it eventually causes health problems such as heart disease. Hypertension affects more than half of American adults. Many people never show any signs or symptoms of high blood pressure. It usually takes years for hypertension to develop. There is no cure for hypertension. There are two types of hypertension: primary hypertension and secondary hypertension. Being aware of hypertension. You should ask your doctor for a blood pressure reading at least every 2 years. If you're at risk for hypertension, you should have your pressure checked more frequently. There are blood pressure machines for the public in some stores and free readings at available health fairs. You can also purchase your own personal blood cuffs as well. However, they aren't always 100% accurate, but they do provide useful information regarding your blood pressure. Ask your doctor for advice on how to get the best blood pressure reading outside of the office. Risk factors for hypertension. Hereditary and physical risk factors are factors you have no control over, such as family history, age. Men are more likely to develop high blood pressure before the age of 64. Women are more likely to develop high blood pressure at the age of 65 and older. African Americans are more prone to high blood pressure than any other race in the United States. High blood pressure may also occur as a result of chronic kidney disease. Modifiable risk factors are risk factors that you can change to prevent and maintain high blood pressure. These risk factors include lack of physical activity, a diet high in sodium, calories, saturated fat, trans fat, and sugar, being overweight or obese, drinking too much alcohol, sleep apnea, high cholesterol, tobacco use, diabetes, too much stress, socioeconomic status, and psychosocial stress. Preventing and managing hypertension. If you live a healthier lifestyle, you can prevent and or manage your hypertension. A healthier lifestyle includes a healthy diet, maintaining a healthy weight, being physically active, not using tobacco products, and limiting your alcohol consumption. Dietary approaches to stop hypertension, or DASH, is a diet that is proven to help people lower their hypertension. Here we have a list of medications used to treat hypertension. Diuretics, which rid your body of sodium and water. Angiotensin converting inhibitors, or ACE inhibitors, relax your blood vessels by preventing the formation of chemicals that narrow your blood vessels. Angiotensin 2 receptor blockers, or ARBs, are medications that help relax your blood vessels by blocking the action of the chemical that narrows your blood vessels. Calcium channel blockers are medications that help relax the muscles of your blood vessels. Alpha beta blockers are medications that reduce nerve impulses to blood vessels. Beta blockers are medications that reduce the stress on your heart and open up your blood vessels. Aldosterone antagonists block salt and fluid retention. Renin inhibitors slow down the production of renin. Vasodilators prevent your muscles from tightening around your arteries. Central acting agents prevent your brain from signaling your nervous system to increase your heart rate and narrow your blood vessels. Here we have a chart showing blood pressure in its different stages along with demographics and its recommended drug therapy. Resistant hypertension. People who have to take 4 or more medications to control their blood pressure are considered to have resistant hypertension. Resistant hypertension doesn't mean your blood pressure cannot be managed. Your doctor can find out what's behind your persistently high blood pressure and come up with a more effective treatment plan. Committing to a treatment plan. Unfortunately, there isn't a one-time treatment for hypertension. To keep your blood pressure under control, you have to make the commitment to live a healthier lifestyle and take your medications as your doctor has prescribed them. It's helpful to have a good support system of family and friends